One of the things that we did was we worked with USD in their MPH program. They were able to kind of provide some of the reach out to individuals aged 65 years of age and older. We had a couple of questions, very short, 5, no more than 10-minute survey that helped us identify whether or not they had received their vaccine already, whether they had access to information to be able to make their decision around vaccination, and then really what was their intent, and if they intended or had not been vaccinated at that point, just kind of asking what were some of the concerns there. By and large, individuals in that 65 years and older age group had been vaccinated at a very high level. We were not able to identify individuals that kind of had been missed, I guess. We actually even anticipated that probably at about 80% of the individuals that we contacted at least had already received their vaccination or were able to schedule their vaccine or knew how to schedule their vaccine. Some of the concerns, in terms of getting vaccinated, are run the gamut. Just they wanted to know a little bit more information about the vaccine. We're curious, the speed at which the vaccine was developed, and wanted to know, more information, or at least wait to see, what happened around people who had received the vaccine. And very few sort of concerns around barriers to getting vaccinated in that population. So, very positive perspective there for access to vaccines, and that goes back to really the strong partnerships that we've had with a lot of the healthcare facilities across the state. So around, we're as the Secretary mentioned, working to try and get back to providing additional information that we think would be helpful for people to make their decision around vaccine. Some of that is going to be talking about how the speed at which the vaccine was produced, and it's cutting the red tape around vaccine production and not shortcuts around the science and safety of the vaccine, and then also making sure that individuals are aware that there's not concerns for the RNA vaccines, which is the Pfizer and Moderna vaccines, to develop or to somehow fuse itself into the DNA of the person receiving the vaccine and things along those lines.
So no impact to DNA, and that's been a persistent misinformation campaign out there.
Yeah, exactly.
Yeah.
Yep.
Yeah.